Hello, good evening viewers. My name is Tejas Dave. I am working as an immigration counselor at Aussizz Group Dubai branch. We are getting a lots of inquiry from the nurses across the Gulf region. They keep on asking the question like whether AFRA authority is accepting the island program, or they have introduced a new OBA program, or any university is giving the admission for the bridging course or not. What is the criteria for the nurses to migrate to Australia? What is the current status of the nurses permanent residency process? So today I am going to brief about the entire nurses Australian immigration process. So as per the data released by the Department of Home Affairs of Australia, they require 17,509 nurses in the upcoming year. This is the highest demanding skill in Australia currently, we can say. So if you are working as a professional nurse, like in a medical field or a surgical field or child care or aged care, then it will be a very excellent opportunity for you to migrate to Australia on permanent residency. If you have studied outside of Australia in a nursing field, then the first stage in the process is to register with the authority called NMBA, or we can say AFRA. NMBA stands for Nursing and Midwifery Board of Australia. They have a certain requirement which we need to fulfill first. The first requirement, like you should not have any criminal history, so we need to submit your criminal check report. Apart from this, you have a you need to prove a proficient English test, or we can say you might have appeared for IELTS academic. You have to get 7 in each module. If you appear for OET, you need to get B grade in each module, and if you appear for PTE examination, then you need to get 65 in each module. This authority also accepts 2 sittings of this examination in the last 6 months. So if you have the English test requirement, then they have the third requirement which also needs to be fulfilled, like you should have 540 hours of experience in last 6 months, last 5 years. And you should be working, you should be having continuous professional development in your field, and wherever you are working, let's suppose you are working in Dubai or any other country, you should be having a registration with the relevant authority, and you need to get a good standing certificate from the relevant authority where you got the license. If you are fulfilling all this requirement, then you can register yourself as a nurse with the AFRA authority, and once you submit all your documents, then they might ask, until this date, before October, they were referring to do the bridging program. So what they believe, if you are studied outside of Australia, then you need to complete a bridging island program in order to register yourself as a nurse in Australia. That might be a 3 months or 6 months of course which you need to complete at any of the recognized university in Australia. If you are completing this course, then you become registered nurse as per the Australian standard. But now, governing authority AFRA is coming up with the OBA program like we have in UK, and they have a certain requirement for this OBA program. They are going to introduce this OBA program in the next year, in January 2020, and OBA will be having 3 different stages. The first stage is called a cognitive assessment, in which you will be required to give MCQ based computer based examination. The second stage in this OBA program is called the behavior assessment. So in this, you will be required to give objective structured clinical examination, which also is related to your subject, related to your knowledge and the skill related to the nursing field. If you are completing the second stage, then you have to go for an orientation program in which you have to study related to the Australian culture and cultural diversity and Australian healthcare standard. Once you complete all these 3 stages, then you can become registered nurse as per the Australian standard. So now the question comes like, when they are going to introduce this OBA program from the January 2020, they are coming up with this program, and nowadays they are giving whenever you are applying for AFRA, they might give you both the options to apply for a bridging program or you can go for an OBA assessment. After 2021, they will close referring for the bridging program, and there will be only OBA assessment as a part of AFRA registration for the nurses. Now, once you get the AFRA registration nurses, then you have to register yourself for the skill assessment of NMAC, in which they will be checking your education and employment document as per their standard, and you might be required to show your English proficiency in the NMAC registration as well. Once you complete after registration and once you get the skill assessment positive outcome in the NMAC, then you will be completing first stage in the process called skill assessment, and then the second stage starts. In the second stage is called the expression of interest, in which you have to meet the 65 points of eligibility criteria, in which your age, qualification, experience and English test score, all these factors plays a role. So if you would like to know whether you should go for an OBA program or you should opt for a bridging program, if you are struggling to get the admission with the university for your bridging program, you can just call us on 058-223-4349 or just drop your CV at dubai@aussizz.com. We are going to conduct a seminar for the Australia immigration of 25th of October this month. So if you'd like to know more details about your profile eligibility, then just call us and book your seat for the upcoming free in-house seminar at our Aussizz Group JLT branch. Good evening viewers, and thank you for watching this video.